I am Dr. David Randall, and this is the Doctor for Pets Show. This is a live call-in show, one of the most trusted live veterinary call-in shows in the world, okay? It's September 6th. Do not hesitate. Pick up the phone and give me a call. I'm here for 28 and a half minutes. Any questions you have pertaining towards veterinary medicine, towards your pets or your neighbor's pets, pick up the phone and give me a call. We talk a lot about, different type of skin problems or training problems. By the way, next week, Colin from Barkbusters is going to be here with me. So if you have dog training questions of any type, don't hesitate. Next week, same time, same place, 6 to 6:30. And you can watch us on the channels. You can watch us on channel usually 9, 14, 237, and 238. And there's also repeats, guys, okay? The repeats are usually tonight at 8:30 and then Saturday, Sunday at about 6:30 on those same channels. It may not be exactly the same channels, but look around. It's called the Doctor for Pets Show. This is something that I give you and call you in Lee County, anyone that's watching the show. Every week I try to donate at least a half hour of time to answer your questions pertaining towards your pets, okay? It is not an infomercial, okay? If I can advise you where to go as far as other veterinarians, I most certainly will, okay? I've got plenty of years of experience and own plenty of pets myself. So, a matter of fact, I just added a horse to my stable and just added a new kitten. I had a really cute little tabby kitten that was running around the clinic for about, since July 2nd. And kept trying to get away and, find different homes for it. And boy, he is really cute. And next thing you know, George is back at the house. He's already got a name and he's good to go. But anyway, I know I've got a couple callers and this is how simple it is. Oh, and guess what else I got for you? I've got several shots of the Grenada dive trip, okay? I tell you guys we do some diving as well as flying around, but I've got some pretty cool dive shots that we shot about 6 weeks ago. And so, who you got, Jamie? Raymond and Rose. All right, I guess we're going to go to Raymond first. Hi, Raymond. I'm Dr. Randall. What can I do for you?
Yes, hi, doctor. I've got a 5-year-old Bichon, and for the last week, he's been coughing like he's trying to cough up a hairball like a cat.
Right.
And I'm very surprised. I've never seen this behavior with him before. And like I say, he'll do it maybe 3-4 times a day, and then you don't hear it at all. Then he starts with it again. What do you think could be up? Do they get hairballs?
No, cats get hairballs. Dogs get scratchy throat, though, for a couple of things. Red tide will do it, but I don't think we're having red tide right now. Pollens will do it, but now with this rain we have coming down, that pollen count should really come down low. I bet you're feeding him a lot of treats, a lot of little doggy biscuits or something.
He'll get 3 a day. Every time he comes in from doing his duty outside, he gets a treat, and that's the only time.
Okay, why don't you do this, Raymond? Why don't you make sure that either you change the treat or you put the treat in water, okay? When he comes in, bring him up by the water and just drop the treat into a water bowl so he's getting water every time you're giving him a treat, okay?
Okay.
I've actually taken some of my labs that love to eat biscuits, okay? I've actually, on the boat in different places, I'll just take a biscuit, drop it in the water so they're drinking it at the same time, or if they're coughing and I think that it's associated to that, I'll stop doing it for, for a couple of weeks. And I bet you it'll go away. Another thing you could do is just a home remedy, and it may or may not help, but a little bit of Benadryl, okay? Diphenhydramine and Abishan, you should be able to give them a standard dose, 25 milligrams. That's a over-the-counter antihistamine that you and I can take, okay? And it comes in a capsule, comes in a tablet, but stop over at your pharmacy and ask them for Benadryl or the generic form, which is going to be a standard dose, 25 milligrams. Do one of those 2 or 3 times a day. And when you do it, don't poke a dry pill down and put it in a little piece of butter, do something with it, okay?
Right.
Now, he has not just been kenneled. He's not just coming out of a kennel where he has not had a flu vaccine or a kennel vaccine, right?
Not whatsoever. No, he's very healthy. He's very happy. He's out there having a ball.
Okay,
But,
medically, the bad things would be heartworms, but I know you've got him on heartworm prevention. That's a no-brainer, okay? And if he's on heartworm prevention, it's not heartworms. As long as he's not losing weight and vomiting diarrhea, I'm not thinking internal parasites. And I'm sure your veterinarian vaccinates him for at least kennel cough, so when he goes and gets his haircut and stuff, he's protected. Let's not think that this is an illness. Let's just think this is a scratchy throat, because of the biscuits and the time of year. And I'm telling you, if you give him some Benadryl and you stop giving him the biscuits or you put the treats in water, just as you give it to him, he'll kind of look at you like, what'd you do that for? All right, that'll stop the cough for you, okay?
Okay, one quick question. The only thing that I do give him is he gets his flea medication, a flea pill, once a month.
Okay.
But this doesn't seem to happen after he's gotten the pill. So
No. But you do not give him the heartworm pill, the Heart Guard, the stuff right here?
right.
Okay. What you should do, you should stop by your veterinarian's office. They'll take a blood test, and as long as his heartworm test is negative, put him on heartworm prevention. The simplest one is this chewable soft tablet called Heart Guard. Very, very
Right.
affordable. Matter of fact, I know for the dogs under 25 pounds, right now at our clinic, if you buy one pill, you get 2 pills, okay? So, I mean, we beat the heck out of Pet Meds or any of those prices and stuff just by the...
He is on heartworm.
Oh, good. Okay. Very
But I
good.
was saying for fleas.
All right, well, the fleas can afford us. You always give that with a meal. So that pill should not be causing it itself, okay? Because
Okay,
when you
that's
give
what I was
Confortis, give it to him with a meal. Just stop the treats or put the treats in some water, and that'll take care of it for you, okay, son?
Well, I thank you so kindly. Thank you. And
Bye.
you're doing a great job.
Thanks. Oh, my gosh. For you guys who don't know, my son's name is Raymond. So, of course, I'm talking to Raymond, and that's what I said, okay, so, wow. Hey, it's Tuesday, right? All right, let's do it, Dave. All right. Hi, Rose. I'm Dr. David Randall. What can I do for you tonight?
Hi.
Hey, Rose.
Hi, good evening. Sorry, I didn't realize there was a delay there. Hi, good evening.
Hey, listen, Rose. I just called that gentleman my son. My mother-in-law's name was Rose, so I'm going to do my best not to call you my mother-in-law, okay?
Yeah, that is kind of a coincidental.
It is. Next thing I'll have Joseph give me a call.
My husband's name is close to that. So we're all kind of interrelated here.
We are.
I'm calling regarding my cat.
Okay.
It's already been determined that she is allergic to fleas. Flea dermatitis or something to that effect.
Right.
And she itches and scratches more sometimes of the year than others, and the other times she's calm. But this creates, bumps on her from the scratching and excessive hairballs from the licking. And I have 2 cats that go indoors and outdoors, and this particular cat stays indoors 24/7. She's always in the house, always. She never goes out. She never even goes on the lanai.
Rose, how old is she?
Between 8 and 10 years old.
Okay. The bumps, she gets some bumps around her neck or around her back and stuff?
On her back,
Okay.
or she's getting them on her side.
All right. Let me at least tell you this, okay? Flea allergy dermatitis is a very specific area. It's right over the tail area on most dogs and cats, okay?
Yep.
When your cat has these crunchies around the neck, maybe the chin, a little bit down the sides, sometimes the tummy has rashes on it, okay?
Yes.
It is an allergy, but that is not an allergy to fleas, okay?
Oh.
It's called miliary dermatitis, not military, miliary dermatitis, and it is allergic dermatitis to pollens and environmental things, all right?
Oh.
And there is not a cure for it, but there's a treatment that's very, very, very safe for it, okay? What you do is you'll take your cat into the vet. They'll do a blood sugar, okay? Just like I do 2 or 3 times a day. Bam. They'll take a blood sample. They'll make sure that the cat is not a diabetic, all right?
Okay.
Cat is not a diabetic. It's going to get a shot of Depomedrol, cortisone, probably anywhere from 3/4 to 1 cc of Depomedrol. And if you do that 3 or 4 times a year, that is sufficient to control the skin. Now, it is a true allergy to something in your world, okay? So it's possible that if you move from Naples, Florida, your condo, and you move up to, Atlanta, Georgia, it may go away. But,
Okay.
But anyway, it's an allergy and the cat just needs a cortisone shot. Flea medicine will not help. A flea bath will not help. And most of these cats, if we catch them early, they don't even need a shot of antibiotics. They'll just go in there and they'll just go in there and take the get the blood glucose, take the cortisone shot, bam, in and out. And But you are correct. It's an allergy, but it's to environmental things. And it's called miliary dermatitis. And your cat just needs to go see a vet, okay?
Okay. Yep. She saw her once, and it was effective, and it just kept coming back, though, so I didn't realize I had to keep going.
There is not a cure for a true allergy.
Okay.
Okay, and this is a true allergy. Anyway, Rose, thank you for your call.
All right. Thank you.
Bye. So, Jamie, are you serious about the next name? Really? Oh, my God. Okay, this brings back old family names. The next one's going to be Stella, followed up by Joseph. Okay, Stella was my German Shepherd that I had, and Joseph is either my grandson or my ex-father-in-law, but who's passed away years ago. Hi, Stella. I'm Dr. Randall. What can I do for you?
Hi, doctor. I have a 10-month-old Schnauzer, and
Nice.
I've had her 7 months, and I've had to have her anal glands expressed every single month.
Mm-hmm.
The veterinarian that is attending to her suggests surgery. He said she has an overactive gland.
Mm-hmm.
But I hate to put the dog through such a painful operation, and I wonder if there's anything else that I could do aside from surgery.
Let me ask you this, Stella. First of all, yes, there are different things you can do besides surgery. And when you take her in, is it because she's sitting on the ground and she's scooting around? Or do you take her in because
partially, but that's one symptom.
Okay.
I could tell she's very, very uncomfortable. She'll be perfectly still, and all of a sudden she will just leap up and swing around toward her rear,
Like she has
as though something just bit her.
Like she has a friend back there in her rear end, right?
Exactly.
They're friends back there. They're friends back there, so they kind of spin around. All dogs have anal glands, all right? And there's some dogs that have more problems with them than other. Matter of fact, I saw a little terrier today by the name of Sparky, and he had a rash by his rear end. It was his anal glands. But we try our best not to squeeze his glands and just let him deal with them himself. Sometimes if you squeeze the glands every month, we're actually causing more of a problem. There is a door. Essentially, it's a pocket. It's in the rear end, and there's a pocket on the right and left side, okay? And when stool comes through the canal, the pocket opens, put a little bit of juice onto the stool. It's the dog's signature on its poop saying, hey, this is mine.
Mm-hmm.
All right, so it's a natural solution that goes on there. Now, why some dogs are bothered more than others, who knows? All right. It's been debated, and I have seen a huge benefit by increasing the fiber in the dog's food and putting them on about a 30-day course of antibiotics, okay? The overproduction of anal gland solution may be just because there is an infection in that area. So anyway, a couple of things. Why don't you totally stop squeezing the glands for 2 months? Just give it a break, okay?
All right.
See how the dog gets along. Then you can increase the fiber in the dog's food by either getting a non-flavored Metamucil and sprinkling some of that on the dog's food. You can buy that at your pharmacies, but you cannot buy Metamucil that has a flavor in it, okay? It has to be non-flavored Metamucil.
Non-flavored.
And yes, ma'am. Put about a teaspoon throughout the day on her food when you're feeding her. The next thing is probably what I would do is I would suggest about a 30-day course of an antibiotic called Primor, Primor, and then the next number is going to be 240. Probably Primor 240 milligrams once a day for 30 days. That's a really good sulfa antibiotic, and it's really safe on the stomach. It causes almost no problems, and we use it for GI bacteria, for dogs that have colitis, inflammatory bowel disease, and I would try that for a month. Now, if you get ready for surgery, I tell you what, do this. I'm not even going to talk about surgery right now for the next 6 to 8 weeks with you, okay? I want you to increase the dog's fiber either by putting Metamucil in the food or going to the pet store and saying, do you guys have a food that has a little more fiber in it? I carry one at the clinic called DCO. It's for dogs that have diarrhea and colitis, and it's a Purina food. But the pet store, wherever you buy your food, hopefully will have something that has a higher fiber food in it, okay? So I suggest DCO from Purina or any high fiber food, or Metamucil, plus your Primor, 240 milligrams, one pill, once a day for 30 days. And don't touch that dog's rear end for 2 months, and then you pick up the phone and give me a call, okay?
Wonderful. Thank you so much, Doctor.
Thanks, Stella. Thanks for your call. Bye-bye. All right. Well, Joseph took a break, but we do have George and Julie. Thank God we're finally getting out. Oh, George, that's my new cat's name. Hey, George, I'm Dr. Randall. What can I do for you tonight?
Hi, Doctor. I just have a question that you seem to know so much. I have an 11-year-old Aussie mix. I think she's an Aussie Cocker Spaniel mix.
Mm-hmm.
Sweet dog, wonderful dog. Nothing wrong with her. But about 3 years ago, if I fed her, and I've always fed her ProPlan and nothing else but just dry food. But about 3 years ago, if she ate beef, anything beef, she would throw up, and she would actually re-eat it. You know. And so the vet told me she can't digest beef, just don't feed her beef.
Right.
So I didn't feed her beef. But I've always wondered I can give her a pork chop, I can give her like chicken scraps, but if I give her a piece of steak beef, a piece of meat beef, a piece of hamburger, anything beef, she throws up.
Yeah, that's unusual. My dogs throw up pretty much all the time. It just depends. My beagles are most sensitive. If food is hot, if you put down scrambled eggs and they're hot, most dogs that eat it will throw it up. If you give them a hot dog or hamburger, most dogs will throw it up. The beagles seem to walk around, they lick themselves so darn much, and they lick the floor so much because they have itchy tongues, I guess, what I've heard. And they get some hair inside them, and then they'll cough it up and hack it up, okay? But there is protein sensitivity. As a matter of fact, we have some dogs that have skin allergies because of a food allergy, all right? It's more common when we're not here in the South. It's more common up north than it is down here. But I quit feeding some foods, like most of the foods that had lamb and rice in it. All right, I quit feeding it just because with the labs, it just seemed like they produced so much gas. I mean, you couldn't even be in the rooms with them. Okay, and I got away from the lamb in my particular dogs, and it helped me out. Okay, but there is protein hypersensitivities, and I guess it's good for the cows of America, right? They'll probably like it. They're like, yeah, eat more chicken, right?
Okay, she seems to do well on chicken, but I was always just curious as to why, for 9 years or so, she could eat steak, bones, everything. And I'm probably bad because anything I eat, and she eats tons of vegetables, and she likes beets, carrots, and whatever. But for suddenly one day she started getting sick on beef, and I just always wondered why. But
hey, George, you don't work for the FAA. You don't work for the FAA, or you're not a tower person, are you?
No.
No. Okay. You sound like a friend of mine that works at a airport tower. Every now I'll hear him on the phone. I'll hear him on the radios, and I'm like, oh, that's got to be George.
Okay. Thanks, Doc.
See you, George. Bye. Thanks.
Bye.
All right, we're going to pick up Julie. Then we're going to take about 2 minutes, and you guys can call in during those 2 minutes, okay? We're going to talk to Julie. Then I want to start showing you some of these pictures from some of the dive trip that we've done this year. And anyway, it's interesting to me. Hopefully that means it's interesting to you. If not, pick up the phone and say, Doc, we're tired with the dive pictures, okay? Dump it. I got a question for you. Okay, Joseph after Julie. Very good. We'll do those two, then we'll do some pictures. Hi, Julie. I'm Dr. Randall. What can I do for you?
Hi, I have a 9-year-old Siamese cat that she was fine until my daughter went off to college. And then she started licking herself, all her hair off of her, and I took her to the vet. She goes regular. She's always been taken care of like that, and they give her steroids.
Mm-hmm.
But she was fine. Her hair started coming back and everything. So now she's, my daughter came back, got a little doggy, then moved out again, and now she wants to mess in the house, particularly on my bed.
So
I know Siamese are...
Well, Siamese are different. Siamese are great cats, but they definitely have their own stress levels, okay? Besides the licking and the grooming, to reduce the stress in cats and usually stop the bad habits of either And by the way, the overgrooming is called psychogenic alopecia, a fantastic word, psychogenic alopecia. And for that and for some of the other things where they kind of, people say cats don't get mad at you, but I think they kind of do. And they're like, okay, here you go, I'm going to leave this on your bed for you as a present. I normally do not use cortisones in those cases. Normally what I'll do is go to a hormone called Ovaban, 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 okay?
Ovaban.
Yes, ma'am. And it is in a generic form.
Okay.
All right. And the milligram strength is 5 milligrams. Okay, so it's
5 milligrams.
Ovaban, grab the generic, 5 milligrams.
Okay.
Your veterinarian will probably have you give 1 pill a day for about 5 days.
Okay.
And then you're going to cut it back to 1 pill twice a week, and you're going to do that for maybe a month or two. And then you're going to go to 1 pill once a week for a month or two, and then you're going to stop it, okay?
Okay.
And it doesn't matter.
So like breaks her out of the cycle?
Yes, ma'am. Yes, ma'am. It's really funny because it's actually like a birth control. It's a hormone, and for some reason or other, it has a soothing effect in cats. Okay, and there's other things you can do. You can kick the cat out, but no, I'm kidding. But Ovaban seems to work quite remarkable in most of these cats. Other than that, spending as much time as possible with her, just brushing her, talking to her, finding something that she likes. Can you imagine, why would a cat be stressed? What does a cat in the world have to be stressed about, right?
Right. She just mad my daughter got a dog.
Exactly.
She came home with the dog, then she went back to college, and it's like really, she's just really showing herself.
Yeah, wait until your daughter brings home a man. That'll do it over the top.
Yeah.
Cat will just sit there and say,
thank you so much.
I'm out of here. Ovaban, 5 milligrams. Pick it up. That'll do it for you, okay?
All right, thank you.
Thank you. Yeah, cats are funny. Let me tell you, boy, you could write books and books on cats. But I know Joseph's back. Hi, Joseph. I'm Dr. Randall. What can I do for you tonight?
How are you, Dr. Randall? I have a Great Dane. He's 6 years old, and he's got like little dry spots on his body, like dry skin, and it just gets a little red. So I put some Neosporin on it, and it works a little bit, but maybe you can tell me what else I can use. Yeah,
I bet you're dealing with a bacterial infection, probably a staph infection. Some dogs have little hypersensitivities, little allergies, and the skin will become a little bit red, the hair will start to kind of fall out, and you'll have some of these round circles, and that's normally a bacterial skin infection. I am assuming that you're probably, if the topical medicines do not work, you're going to have to go to an oral antibiotic, okay? But right now, my most favorite thing is Absorbine Junior, okay? They used to have Absorbine that you'd rub on horses. It's a liniment to loosen up their tendons and stuff, get them warmed up so they're getting ready to go. But you want to pick up Absorbine Junior, and I'm sure that your grocery store, and I know that the local pharmacies carry it, okay? And you'll sit there and look at it like, wait a minute, this is crazy. It's Absorbine Junior. You're supposed to be rubbing it on for sore muscles or aches and pains, okay? And I'm telling you, okay, being a scuba diver, having to deal with bacterial infections on your feet from being in the water, wearing booties all the time. I ain't talking about that type of booty, I mean booties on my feet. If it wasn't for an old fisherman down in the Keys, I would not be able to give you this advice, okay? But I'm telling you, this stuff works. Go get yourself a bottle of Absorbine Junior, and it'll be a little sponge on the top of it. Take the top off, dab it on the skin 2 or 3 times a day. Try that for about 2 weeks. If not, George, you're going to have to probably have your veterinarian prescribe some antibiotics for you, okay?
Yes. I also, when I shampoo him, I have that medicated shampoo on it, and it helps a little bit.
It does, but I mean, a lot of these guys just have, bacterial, especially the purebred dogs, the short-haired purebred dogs. Bacterial staph infections are common, and a little bit of allergy skin and stuff, but my newest and most improved free advice to you is Absorbine Junior, okay?
All right, thank you very much.
Thank you for your call, appreciate it. All right, Jamie, while we're waiting, I know we have a few more minutes of the show. Why don't you start showing some of the pictures from the Grenada trip? I'll tell you guys what it is. If you have any questions, don't hesitate to pick up the phone and give me a call. This is a plaque when thanking the Ronald Reagan and the American soldiers that came in there and freed that country back in 1983. All right, there's myself and Eric. I'm sure Christina's in there someplace. These are friends we met on the dive trip. 20 of us went on this dive trip down to Grenada. Fantastic. Our dive master sitting down there. Everyone's paying attention. He's telling us how many sharks are going to be getting to us and killing us and everything. That's the volcano. That's the lake on the top of the volcano in it. There's some other our friends that were on the trip. Anyway, 20 of us are diving. Eric Will is a good friend of mine, okay, a pilot. Matter of fact, he's a scuba instructor, okay? If you guys are looking to scuba dive, give me a call. These are some of the shops and some of the stores in Grenada. Oh, let me tell you, I'm going down the street. Here we are in Grenada, going down the street. These people love freedom, okay? Actually had 3 different times at 3 different locations, people walk up and shake my hand and say, "Are you American?" "Yes, I am." Shake my hand and they're like, "Thank you for freeing our country. Thank you very much." And I'm telling you, this is what freedom means right here, okay? This is an economy. They elect their presidents, okay? They look north and they see Cuba. They look to the west and they see Venezuela and Chavez, okay? Chavez. And that's the difference. This country is a fantastic, fantastic country. Anyway, a lot of the dive places that we went to, and the water is great. We've got about 100-foot visibility down there. We had almost no current. Water temperature was about 88 degrees. And it was just really something special as far as a dive trip. It was amazing that we could go down there. 20 of us went down for a week, made the trip, no accidents, good restaurants. You felt very safe in the country, and the diving was just absolutely spectacular, as you can see right there. This is too good. All right, we got 1 minute left, so I'm going to wrap up the show. Keep the pictures going, Jamie, okay? Huge lobsters, huge, okay? Huge lobsters. Brian, my friend at Pets at Peace, if you lose a pet, give me a call or give Brian a call at Pets at Peace. We've got here in Collier County our own crematory service that will take care of your pets, okay? So that's a good thing. Colin from Barkbusters, the world's largest pet training organization, will be here next Tuesday. Don't hesitate, give me a call. We're dropping down to a 130-foot wreck right here, and the guy with the camera is probably about 80 foot away from us. Look at that. That's me in the front of the line there, just dropping down, just falling down. Thunder shirts, I've got them at the office. That's a huge crab, huge. Anyway, Thunder shirts, if your dog's nervous, don't hesitate, give me a call. That is concrete, by the way. I did check it and see with some people. Look at that dive. That's great. I got to go. I'll see you guys next Tuesday. I'm Dr. Randall. Bye-bye.